important stainings, and this is the important stainings in pathology and microbiology. So firstly, we are going to look at some questions. So where is the H&E stain used? Next is, where is Alcian blue? Alcian blue, where is it used? Warthin starry sign is used in what condition? Stain is used in what condition? So we'll find out the answers to these questions and a lot more in this video. So firstly, there is the H&E stain. We are going to focus on pathological stains first. So under H&E stain, this is used, it is most commonly used stain in case of the routine histopath examination it is used. And what about the disorders? In case of the disorders, it is commonly used for all slides. It's used for all slides. Next, we look at the Papani close stain. So this stain, it is a universal stain for the cytological preparations. Cytological preparation, and it is universal. Universal stain. And looking at the disorders, it is used in case of the cytological studies, as we mentioned. Then we move on to the PAS stain. So the PAS stain, it is used to demonstrate the glycogen as well as the mucin and the fungi and the macrophages. Then looking at what are the conditions it is seen. So it is used in case of disorders such as the Whipple's disease, also in case of the adenocarcinomas, then in case of the glycogen positive tumors. So what are the glycogen positive tumors? It includes the Evans sarcoma as well as the renal cell carcinoma. Next, we look at another staining, that is the PTAH. So this is nothing but the phosphotungstic acid hematoxicid. So this is used in case of the fibrin, staining the fibrin, and the disorders, it involves the gliomas. Next, the ependymomas. Then also the tumors of the skeletal muscle as well as the fibrin deposits. Then we move on to the other staining, that is the Alcian blue. So the Alcian blue is for the acid mucins. So it stains positive. So the staining is positive for the mucins of the intestinal mucosa, and it is negative. It is negative for what? It is negative for the mucosa of the mucins of the mucosa of the gastric region and also the Brunner's gland. Now looking at the conditions, it is seen in case of the Barrett's esophagus. Next, as well as the gastric disorders. Then we look at the staining, that is the Pearl's Prussian. So Pearl's Prussian blue. So in case of Pearl's Prussian blue, it is used to demonstrate the hemosiderin. So the hemosiderin as well as the iron. So the disorders it includes is the hemochromatosis. Next, we look at the Mason's Fontana stain. So what is the Mason's Fontana stain? It is used to demonstrate MM. So it is used to demonstrate the melanin. And the conditions it is used in conditions such as the nevus and the malignant melanoma. Next, we look at the von Cosa method. So in this particular method, it is used to demonstrate the calcium. And what about the disorders? The disorder is used in case of the calcification of the tissue. Next, we are looking at the Van Jayson stain. So this is used to demonstrate the collagen. It is used to demonstrate the collagen, and it differentiates the amyloid from the collagen. Next, we look at the disorders it is associated. It is associated with the spindle cell neoplasm, as well as the delineate extent of the fibrosis. Next, we move on to the Mason trichome stain. So the Mason trichome stain, it is used to demonstrate the collagen and also the muscle. So the disorders, it includes the connective tissue disorders as well as the muscle and the fibroblast tumors. Next, the liver cirrhosis as well as the neuromuscular disorders. Then we look at the next staining, that is the reticulin, stain. So this reticulin stain is, as the name suggests, is for the reticulin fibers. And what does it do? It is the disorders is that it distinguishes the epithelial from the non-epithelial neoplasm, and also the Hodgkin's lymphoma and early cirrhosis of the liver and the myelofibrosis. Next, we move on to the warehouse method. So under the warehouse method, it is used to demonstrate the elastic fiber. And what about the disorders? It is in case of the malignant hypertension as well as the arteriovenous malformation, the aneurysms, Marfan syndrome, as well as the emphysema of the lung. Next, we look at the oil red O Sudan and black Sudan 3 and 4. So this is used to demonstrate the fats as well as the lipids. And what are the other disorders it is associated with? It is associated with the fatty liver, that is a fat embolism, fibroma, and the thecoma of ovary, that is the liposarcoma. Next, we are going to jump in the microbiology stains. So, in case of the microbiology stain, first we look at the Zeal-Nielsen stain. So the Zeal-Nielsen stain, the uses is that in case of the mycobacteria it is used. So this can include almost all species, and it also includes the Mycobacterium leprae. It also includes the Nocardia species and the cyst of the Cryptosporidium parvum. Then it also includes the species of the Isospora and the Cyclospora species, also the head of sperms. Next, we look at the Mason-Fontana. Mason-Fontana is used in case of the melanin as well as the argentefin cells. Then we look at the Gomori methamine silver. So in case of the Gomori methamine silver, it is used in case of the fungi. Next is the Luxol fast blue, that is the LFB. So this is used for the myelin. Next, we look at the phosphotungstic acid hematoxicillin. So this is used in case of the cross striations, and this is of the skeletal muscle as well as the fibrin. Then we look at the toluidine blue. So this toluidine blue, it is the used in case of the mast cells. And next, looking at the Warthin-Starry. So in Warthin-Starry, this is used for the H. pylori as well as the spirochetes. Next, we look at the Van-Gieson. So this is used for the collagen fibers. Then looking at the muciramine. So muciramine is used in case of the mucin. And the Cryptococcus capsule. So now to answer the questions. So the first question we asked was, what is the H&E stain? So the H&E stain is nothing but it is common stain which is used in the routine histopathology, and it is commonly used for almost all the slides. So the next question was, in case of the, what is the Alcian blue? So the Alcian blue is for the acid mucins, and it stains positive for the mucins. It is positive for what? It is positive for the mucins, and this is for the intestinal mucosa, as well as it stains negative. It stains negative for what? It stains negative for the mucins of the gastric mucosa. Gastric mucosa and the Brunner's gland. So what are the disorders it is associated with? Associated with the Barrett's esophagus as well as the gastric disorders. The next question we asked was, where is the Wharton starry? Wharton starry stain seen? So this is seen in case of the H. pylori as well as the spirochetes.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.